Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Bowel Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
I have a question here from somebody with an 8-year-old son who keeps getting tummy aches. There's a history of bowel disease in the family and I'm worried he may have something serious. Do you think this is something they should get checked out?
Yes, I think so. I think tummy aches are very common in children, and it's fair to say that the majority of children who have tummy aches, we won't find a medical cause for them. And they are often related to a number of different things, but stress, anxiety, all sorts of things. But it is important to get your child checked out to decide if that's the case. And the sort of worrying signs in a child would be weight loss together with their tummy aches, or looking rather pale, or having poos which are either very loose or contain blood or mucus. And those children, right away, we can tell that there's an underlying problem.
Rings alarm bells.
That rings alarm bells, but they're the minority. The majority of children actually are very fit and well, and they've got a good appetite, and the tummy ache is interfering with their lives, but not to the point where it's making them unwell.
And this particular question, of course, there's a connection with the family and bowel disease.
Yes.
Family history, when it comes to medical history, is very important, isn't it?
It's very important. It's important for two reasons. One is because there may be a connection between this child in terms of illness, but also it's important to know what the fears of the parents are. Because sometimes parents are worrying about something which is needless, because it's obviously not a problem that's going to affect a child of this age, bowel cancer being a common one. So sometimes parents come in saying, you know, the grandmother died of bowel cancer and my child's got tummy aches, and that's what they're really worried about. And you can immediately reassure them that that's not going to be the problem. Having said that, if a child has something like a parent has Crohn's disease or inflammatory bowel disease, yes, rarely children can have Crohn's disease, and that can be a real worry for parents, and it is important to try and eliminate that.
So it's always great if a parent comes in and really speaks their mind. Don't feel foolish about your fears. Tell the doctor.
Just tell the doctor what you're worrying about, and then we'll be able to reassure you, hopefully, or do the right tests.
Great, Sue, thank you very much. And if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.